Okay, so I know a lot of people ask you about their heart because as soon as they hear you're a radiologist, but yet you do advanced cardiovascular imaging, which means you're always looking at hearts all day long. People always come to you and they're like, oh, I've had this chest pain, or we have neighbors come over, friends call us. We've had things from everyone from panic attacks to family history to just being nervous of what they have. So I guess the first thing people kind of want to understand with all of the technology that you're utilizing is when it comes to like where does it stop? Like where's it span? Like you've said that basically everyone has some kind of heart disease. Is that right?
Cardiovascular disease, or the one we're talking about, coronary artery atherosclerosis and plaque, is actually more localized to the coronary arteries and vasculature system. But with coronary arteries, that's where it becomes somewhat of an issue because it starts early, like you were asking, sometimes in your 20s, sometimes in your 30s. But they usually call it a silent killer. Cardiovascular disease does occur elsewhere, but it's of particular interest and importance with the smaller coronary artery vessels. And silent because it will develop early, it'll start early, but you won't know about it clinically or symptoms.
That's starting to make sense to me. Okay, because right, it's pumping out to everything, and otherwise your body's acting fine. You're not having like a blue finger or something like this. But the small vessels within are
the aorta coming off immediately from the heart is
fine,
30 millimeters in diameter, where a coronary artery is probably about 6 millimeters and gets very small quickly to 3 and 2.
And just
1.
Those tiny little things being cut off can cause a heart attack?
Yeah, I liken that to the analogy of a hose, right? Just out to your grass or, any type of watering of plants or something. So if you have these hoses, little, and in this case, little tiny hoses, anything that gets stuck in the hose is going to start to restrict the flow of the water or the nutrients to the grass in that analogy case.
Right.
So if you block up your hose progressively, either minimal to more moderate blocking to completely blocking, you're not going to get any water or nutrients to your...
So where do things like panic attacks and stuff come into play?
That's different.
Stress test, heart attack.
Two very different things.
Right, like nerves, heart attack, two very different things, but you're going for stress tests.
Symptoms.
Yeah, and then you're going for EKGs or things like when the
because
EKG,
the
blood
worrying
work.
issue is not so much is she having a panic attack, make sure she's
not
having a heart attack.
Right, so then, but that's where CTA comes into play, right?
Correct.
That's also known as CT of the heart.
Yes.
For people who don't know what a CTA is, it's just a CAT scan of your heart.
It's a CT scan of
your
heart.
So normally, though, we would get chest x-rays. Like if we went in prior to, was it 2022 when they changed indications?
Late 2021.
Late 2021, they changed indications to say if
chest
pain, but you were previously sick or you have background of being sick with heart stuff.
You went down a different decision pathway. So before the change of the ACC, AHA chest pain guidelines, your standard of care for a workup of chest pain would include, like you're saying, an EKG, a chest x-ray, maybe some lab work to look at enzymes, and if you move down that pathway, the first line testing, imaging testing, would be some type of stress test, a nuclear stress test.
Stuff. Okay, is that what nuclear stress test is? Nukes.
Nukes.
Is that different?
Nuclear is utilizing a nuclear agent in your bloodstream to show images of your heart during a stress.
Okay, and then a CTA,
exam.
sometimes you guys will use contrast.
Correct.
So when it comes to injecting contrast versus nukes, does it Are they both kind of equal when it comes
It's
to...
an injection, but they're different things, right? So the injection for a nuclear scan is injecting a nuclear radio tracer,
Okay.
right? And
Is it it's radiation, I guess, right?
it is.
Okay.
Yeah, and in CTA they inject you with a dye that you can see with the X-rays. It delineates the structures of interest with the
And
X-ray
what's the
machine.
dye? Like, what is the dye?
So the dye is a
Like, I know they always ask if you're allergic to shellfish.
yeah,
That's
and
a-
that's really kind of an old idea
Yeah.
because originally it was used with an agent that you could be allergic to that had similarities
Oh,
to.
and not anymore?
Not anymore. They use a
Okay.
different type of contrast.
Okay.
But it's basically a contrast that you can see with the X-rays to show the vessels that the contrast is in.
Okay, yeah. And then, so I guess going off of that too, with that, you know, when would a person know? Like, I had my friend from Canada who just wrote me recently, and she said her husband's going through all these tests and things, and she wanted to know, which I have to actually get you on the phone with her, but she wanted to know, like, he's going through all these tests. He did all this and things we talked about, like the stress test, the nukes, or whatever, blood test, but now they're going to give him the CTA, but not until March is when they can get him on the books. So, like, what kind of like decision tree was that? Do you think because if he's still having problems or they can't find anything? So now they're like, well, we can't find anything, but we have this newer test now that's being given. Is that kind of what's starting to happen with the CTA? Like, what other test is available if we keep finding nothing?
Yeah, basically that's the idea. So
Okay.
it's not necessarily a newer test, but it's new to
been around.
the indications.
Right.
So now it is
Part of
with
the decision tree that
part of
doctors
the
use.
early decision tree.
Right. It's not no longer like you have to super wait for super specialists and go dig it out and find it. It's like, oh, that's a part of our regular decision tree now when it comes to chest pain, heart attack things.
Yeah, especially in that kind of a case. So a person who is younger and has been having tests and we're not quite sure, is it related to the heart? Is it related to the coronary arteries and a heart attack type chest pain that he's having, or is it not? Is it something else, right? Like a panic attack,
Right.
or maybe a rib fracture or a muscle pull that he doesn't know
see,
about,
those are, yeah.
some kind of other.
And you could see that with the CTA?
Sometimes you can.
Okay.
With a CT, it's more available to be seen than any of our other tests. So he would get that test because, especially with the part of the test that's so important, it's negative predictive value, meaning that when a test is normal, when a CTA is normal, it's completely normal. When you have another test like an EKG or a stress test, a nuclear test, if you have a normal test of those tests, that doesn't necessarily mean that you're without a chance of there truly being coronary artery or heart attack related disease there. The CTA is the most powerful test to say if it's normal, you're normal with cardiovascular disease, meaning if you get the thumbs up on a normal CTA, your chance of having a coronary artery or a heart attack type event in the near future, and I'd even push that out a little bit to say somewhere between 5 and 10 years, you are very unlikely or near zero likely to have a heart attack event. We call it MACE type event, or a major adverse cardiac event.
Where does that, now that you said that, where does that, the calcium score play?
Yeah,
because
so that's
people
a good
always talk, like
question.
that's like even in gyms now you hear about it all the time. Like
Yeah.
not so much the CTA yet, But you
Yeah,
will soon with the
correct.
preventative
That's not
care.
a
But
CTA.
yeah, the calcium score, like how
Yeah,
does that
it's a little bit
play?
confusing.
Yeah.
And
First of all, how do they test for it?
another great test. So the only thing that's different from that and a CTA that we were talking about, calcium score versus CTA. Calcium score is the same CT chest, localized to the heart. The only difference is you're not getting contrast.
Oh.
Contrast I liken to the water in the hose. So this would be not
Not seeing the flow.
So I guess that's a good example, because if it's a clear hose with water, you just can't see in it, right?
Just the outside.
Just the outside. So if if you get a calcium score, you get a CT scan without illuminating the vessels, the little tiny vessels, which is actually what we're looking at. However, calcium score is nice because when I talk about cardiovascular disease and plaque, which is the specific disease process itself. So coronary artery disease, or the blockages we talk about, actually what I'm really talking about is you develop plaque in your coronary arteries. Plaque comes in two forms, or I should say a progression of form, where it starts out as a non-calcified,
I remember you telling me this. Go ahead.
inflammatory type
Right.
process.
Like if you like fall and skin
I
your
liken
knee.
it to, yes,
Right,
I
I
liken it
remember
to
you-
falling and skinning your knee. So
Yes.
when you first fall and skin your knee, it's a cut and inflammation, and it's kind of red, and maybe you're bleeding, but over time you scab or heal over it. So that's this example of coronary artery disease, where it starts out as a non-calcified inflammatory process, but as time goes on, it calcifies. That's the scab.
I see.
So as you heal these lesions, they calcify. And here's the great part. A CT of the heart without contrast will show the healed calcified plaques. But that leaves out the early, if you fall into a category before it calcifies, you won't see it on the calcium score. Great test, it's showing that you have disease or plaque, but if you, like I said, fall into a category where maybe you're young and you haven't fully started to heal these yet, you can have the non-calcified plaque and serious plaques. Like really
So you can
compressing
still
the vessel.
have the skin knee, but so you would come up with as a 0 calcium score because it hasn't started scabbing yet.
So that's why if you want to see all of the true plaque,
Contrast with CTA.
you have to have the contrast.
Wow.
That catches or includes visualizing that non-calcified
Because the
plaque.
scabs, also known as the calcium, or the plaque, that's what eventually will clog the
Well, here's the kicker.
Oh, okay.
That's the kicker.
Okay.
Is the non-calcified plaque is actually the plaque that's what we refer to as the high-risk plaque. So when you skin your knee, it's more able to be broken off. It hasn't like patched itself yet.
Oh, yeah.
So it can break off and send little emboli, we call them, down the vessel and get clogged in the distal vessel. But that clogging is more of an acute event, right? If you heal that plaque or patch it or calcify it, it's sort of a slow process. So the flow of water or blood is able to adjust itself a little bit. Whereas if you send off a little emboli, it clogs it real fast. It's an event that your heart muscle isn't really prepared for, because your heart muscle is expecting oxygen.
Right.
And if you slowly depress that, your muscle can compensate for it. But if it's an acute event, it sort of sends it into irregularity, like you get muscle twitches, ventricular fibrillation, ventricular tachycardia, these irregular heart rates, because the muscles
And we have friends that have that too, right? And sometimes that's like a natural thing. Like
Yeah, just like you said, a panic attack is similar to that. That's why all these cross over in symptoms sometimes. So what you're talking about a little bit is, I'm mostly describing the the vascular portion of the heart,
Yes.
where it's getting the oxygen in the
Yes.
blood. But the heart is actually, just like most of the body, it's neurovascular. So it not only has blood vessels going to it, which are extremely important, but the nerves that go to it help it, or not help it, but they tell it how to contract. And it
Right.
contracts naturally. But if the muscle itself isn't getting blood and it's starting to die, these neuro bundles that also go
Spasm.
through the heart, they start to have challenges and die or atrophy. So then the contractility and the muscle smooth motions of the heart get
And that's
challenged.
when you feel that
That's when
flutter.
you can, right. So panic attacks can cause that same feeling, but also the natural process of the heart getting older,
Yeah.
including,
So a CTA would clear that too.
well, a CTA would visualize so much more of this.
You could see inside.
Yeah, and
everything.
it's very specific and individualized to the disease. So it's the only test we have that can directly visualize the plaque that you're talking about, or that we're
That's
talking about.
amazing.
So it can directly visualize the actual plaque itself and quantify it and evaluate it.
And by the way, this has been around forever, this test.
This test has been around for some time, almost 2 decades.
Yeah. And that's how long you've been doing it.
Correct.
And now, though, because of the late 2021,
Because of the guidelines,
it's blowing up a little more.
and significant increases in the power of our studies that have shown its power in these areas, because of the data, because of the test itself. It's now been placed in the indications as a very strong Class 1A indication, meaning it's the test of choice with very significant, important backed studies and data for people who have low to intermediate risk and no known disease. Because of what I said of, as you age, the calcified plaque becomes more and more significant. And in CT, you're imaging with photons, which get challenged.
Yeah, I want
or
to go into that in
artifact.
another video, though.
Yeah,
I really like that stuff, too. I think that's interesting.
that's a good one, too.
But I think from this video, like maybe we'll get people asking questions, and then we can start helping like in a Q&A, and then create more of these videos that people can just kind of comment or write to us, and then we can hit different topics for different things.
Perfect.
Does that sound good?
Yeah.
Thanks. Hi, everyone.